So in terms of my background, I was in the PhD program in mental health services research. I finished up in 1999. I'm currently the policy research director for the American Psychiatric Foundation, which is affiliated with the American Psychiatric Association. And I have to say, I have to preface this by saying I had a fabulous, fabulous experience in the department. But unfortunately, all my memories were not so fabulous things. And one of my most poignant memories was that in 1986, I came here to visit as a prospective student in Richard Frank's mental health economics program, a doctoral program. And I was very excited because I knew it was exactly what I wanted to do. And that visit consisted of one meeting with a very depressed, smileless doctoral student in a windowless office. So consequently, I ended up going to the Kennedy School instead. And I only say that, I'm sure things have changed dramatically, but yeah. But I can also say that, actually my training, although I enjoyed the Kennedy School, I met my husband. That was a fabulous experience as well. But the training that I received at Hopkins was really much more rigorous and much more helpful in my career. But I was asked specifically to talk about how my training here affected my ability to inform policy and practice and make a difference in public mental health. And I have to say that was kind of a sobering experience. And it shouldn't come as a surprise. I remember actually when I was finishing up, and when I was getting ready to defend my dissertation, my husband at the time, 2 days before my defense, had started to read my dissertation. And I really, at the time, he was chief of staff for Senator Feinstein. I really valued and trusted his opinion. And he just read the abstract, and he turned to me and said, "This is the worst written thing I've ever read. I don't think a high school English teacher would give this a passing grade." And so, knowing my husband, that's okay. I went to my defense, and thankfully it was a completely different experience, thank God. And Professor Brakey was very positive about what I had written in my work. So early on, I think that was a wake-up call to me about the challenge of, research, bridging research into policy. And I have to say, I do think my training, so I did come back about 9 years after the Kennedy School, and thank you, Dr. Leaf, so much for giving me an opportunity to do that, because at the time I'd been working for 2 years for the American Psychiatric Association, helping them set up a practice-based research network. So I'd had that experience, and then working on a degree in mental health services research, I kind of say it was kind of like working at CVS and getting training and getting a PhD and working at CVS, because I was learning exactly what I was trying to accomplish in terms of developing data collection instruments and implementing and fielding studies, statistical analyses, writing up the findings and grants. And so it was really a perfect fit, and I'm so grateful to the training that I had. And I had to say, most I was working full-time and doing classes part-time. That was also a huge advantage. Because I think a lot of the students were under enormous pressure to do all the coursework at once. And so at any rate, in terms of thinking about programs and how things are structured, I felt like that was a big advantage for me personally. But in terms of reflecting on my career, I feel like I should have brought my CV and go down my papers, because again, it's been limited in terms of affecting policy and improving care. I guess I never realized what a challenge that would be. In fact, one of my first papers I was very proud of about 20 years ago, it was just clinically detailed data on a national sample of patients with schizophrenia. And it showed while most were getting kind of evidence-based pharmacologic treatment, the majority were not getting the evidence-based psychosocial treatments. And they were already seeing a psychiatrist, so they were already having the best care possible. So I thought that was really important, and, boy, if we show these findings, people will care, and it'll change policy and more resources to improving the system of care. Well, I'm still working along that line of work, and but I do have to say some of the work, interestingly, that recently that I did with Walter Reed in the Department of Defense, that was extremely rewarding because we were working, it was a very small contract, it was probably $250,000, but they lacked clinically detailed data because of their electronic health records have a lot of limitations. So we just provided a lot, clinically detailed data on a sample of their patients. And because we're working with senior leadership, they made a number of changes practically in real time. And again, that was immensely rewarding. So I won't march down or go through details of what they did in terms of my resume, but I do have to say, just in terms of reflecting on my experience in the department as a student and even now as an adjunct person, I'm really grateful because I think the faculty that I've worked with have kind of had this trifecta plus one, and that is, the faces here, they've, in my experience, universally been incredibly rigorous scientifically, and that has really helped me. They've also had practical applied skills, which in my experience quite often don't go hand in hand, sometimes in science, being scientifically rigorous and having that applied sense. And they've been very productive, those three things. But the other piece, I've got to say, like in reflecting on my research and my career, research is, it's challenging and it's grueling, and it's not always a picnic working in a highly competitive field with highly critical people. And it can be tough at times. It can be extremely rewarding, but also very challenging. But I'm really grateful that all of these people, have extended kind of kindnesses too, in addition to all those other attributes. And that's really helped to sustain me. So I guess publicly I just want to thank Dr. Leaf again, because I wouldn't be here had he not invited me to participate in his program. And Ramin has been really very valuable and helpful the past few years, and a very kind and supportive collaborator, as many of these, and I don't know if you know the ways that you've contributed positively, but you all have. And this is my 18-year-old daughter. I don't know if anyone remembers, but I was pregnant, I think, in 1997 when I was finishing up. And so there she is.